Welcome to the Health Made Easy podcast. Health advice so easy, you'll feel more confident about your body, health, and life. And now, your host, Dr. Connie Jean.
Hey everybody, this is Dr. Connie. So in functional medicine, we have a saying, when in doubt, treat the gut. Autoimmune disease is on the rise all over the world, and many have symptoms but are not yet diagnosed. And autoimmune disease can take up to 5 years to diagnose. So logically, if you have symptoms that you're struggling with, why not get a head start and reverse the symptoms before they become a full-fledged disease? There are many precursors to getting an autoimmune disease, but we know that environment, genetic disposition, and our gut permeability are the three essential elements in developing an autoimmune disease. So today, I want to go a bit deeper to discuss why addressing our leaky gut is a wise first line of treatment for essentially every autoimmune patient. Let's talk a little bit about LPL, or lipopolysaccharides. They are large molecules found in bacteria, of gram-negative bacteria to be exact. And they are what's considered an endotoxin, which elicit a strong immune response when absorbed into our body. And our bodies create antibodies against LPS. And when LPS enters through our gut barrier into our systemic circulation. So gut permeability then can result in systemic inflammation through translocation of the lipopolysaccharides in our digestive system. So here, the image on the right are lipid portions of the lipopolysaccharides that are part of the outer layer of the cell. The endotoxins are released when the bacteria dies and the cell wall breaks apart. Why is this important? In humans, the presence of LPS, or lipopolysaccharide, triggers an innate immune response, activating our immune systems and producing cytokines, or inflammatory biomarkers. And inflammation is initiated due to the reaction of those cytokines. So what are the causes of intestinal permeability or leaky gut? Well, it's poor dietary choices and stress and emotions, or negative emotions to be exact, some infections, lectins and grains, systemic disease, low stomach acid, and toxic exposure, food allergy, malnutrition, dysbiosis, and toxic overload. These all collectively result in elevated total toxic and antigenic burden, which ultimately leads to systemic disease. So what then is metabolic toxemia, or endotoxemia? It affects 1/3 of the Western population. It's when the LPS, or the lipopolysaccharide levels surge up during the first 5 hours after a meal. Meals that are high in fat and dense in calories cause a greater increase of LPS. And elevated inflammatory markers are measurably high. And these inflammatory markers are IL-6, IL-1 alpha, triglycerides, and insulin. This is important because chronic metabolic toxemia has high rate of increase in risk of developing various chronic diseases. Such disease include cardiovascular disease, diabetes, obesity, autoimmunity, and mood disorders such as anxiety and even depression. So what happens when our body is flooded with toxins? Well, our immune system is activated and our immune cells recognize the patterns of the bacteria. And these immune cells are further bound with our transfer proteins in our body, or in our cells, to cause an immune inflammatory cascade. And the pro-inflammatory markers are released and spreads to all parts of our body, including our brain. Not only that, the LPS is a common trigger of insulin resistance, obesity, diabetes, as well as, again, autoimmunity. And toxemia is increased during fed state and decreases during the fasting state. This is why I am an advocate of intermittent fasting. So Metabolic toxemia also has proven to increase weight gain. And how it does so is by increasing inflammatory markers in our body and increasing triglyceride production in our liver and increasing the resistance to insulin. So ultimately, lowering the LPS in our body is key to control our immune-related metabolic disease. Yet, most medications prescribed for lupus or autoimmune conditions further add to this toxic phenomenon. Remember, a healthy microbiome is essential to neutralize our lipopolysaccharides, improve our gut barrier, and increase regeneration of our cells. And our immune system is triggered by dysbiosis and intestinal permeability. Why treating leaky gut makes most sense? Well, we know that there is a direct correlation between our genes and the environment. And the connection between the gut permeability and autoimmunity is super clear. And 3 conditions must be present for autoimmunity to develop. This is genetics, environmental trigger, and leaky gut. And 2 major irritants that increase gut permeability is gluten and translocation of colon bacteria into the small intestine. The microbial toxins induce a phenomenon known as a molecular mimicry. We think that this is the cause of autoimmunity. Many microbes produce structures that resemble or mimic the structure found in human tissues. Specific microbial proteins are similar to human proteins. So when our immune system fights against these microbes, our antibodies and T cells begin to cross-react with tissues of the human host, which is us, causing an autoimmune reaction. The autoimmune process can be stopped if the environmental triggers can be prevented. This can be done by reestablishing intestinal barrier function. Which patients does this affect? Lyme disease patients, autoimmune like Crohn's, RA, lupus, Hashimoto's, MS, autism, any immunosuppressed patients, fibromyalgic patients, irritable bowel syndrome, intestinal permeability, hypersensitivities like allergies, and patients with eczema, rashes, and chemical or food sensitivities. All the meds that are commonly prescribed for autoimmunity have a negative side effect of worsening our gut permeability. And this is because immunosuppressive therapies for inflammatory disease allow pathogens driving these processes to spread with greater ease. So a little bit about zonulin. Why go gluten-free if you have autoimmune condition? Well, it's all because of zonulin. Zonulin is a protein in the body that is released when gluten and bacteria are ingested, which causes leaky gut. Zonulin, toxins, and lipopolysaccharides and inflammatory cytokines enter our circulation, and this in turn triggers an immune response and inflammation in our body. And zonulin levels are increased in those with following conditions: SIBO, celiac, type 1 diabetes, MS, Crohn's, ovarian cancer patients, pancreatic cancer patients, schizophrenic patients, autistic patients. And there is a high index of suspicion for toxemia in all these patients. So if you suspect you have an autoimmune disease and want to address your leaky gut issues, decrease inflammation, and get to the root problem, follow what we consider the foundational nutrition support for autoimmunity. Specific for gut permeability and dysbiosis